All right, so we're going to get into the reflex performance reset, so RPR. We're going to talk about zone 1 today. I gave you an overview of reflex performance reset. RPR is the foundational component. So we really want to focus on zone 1. Zone 1 is the most important zone, and we'll touch base a little bit on how to activate zone 1 and address zone 1 of the body. Okay, so RPR zone 1, breathing is going to be the foundational component. So we want to address the central nervous system. Breathing is going to be the cornerstone of everything we do and how we survive. Nothing is as important. So with zone 1, part of zone 1 and teaching zone 1 of the RPR application is teaching clients and individuals how to perform diaphragmatic breathing. So belly breathing allows to reset, to hold longer. So when you're doing the application, central nervous system, it allows that component to communicate for a longer period of time. So belly breathing also increases psoas function, which we'll talk about the psoas and how important the psoas is in movement patterns and survival. Increased psoas function opens up performance capacity for the whole body. So in how the diaphragm, or where the diaphragm sits, and how the psoas is one of the attachments, the diaphragm almost sits right on that fascia line of the psoas, which is quite interesting. So again, zone 1, breathing is going to be the foundation, and diaphragmatic breathing, in fact, to address the central nervous system. So zone 1 is going to consist of obviously the breathing, diaphragm, hip flexion, and hip extension. That allows us to move, right? Hip flexion, hip extension, that's the movement pattern in general. Obviously, the diaphragm can affect those components. So the diaphragm reset, we do an application or a diaphragm reset on the chest area. So down the diaphragm, our sternum, and then right where the diaphragm, are pretty similar location where the diaphragm should be sitting in each individual. Obviously, individuals' rib cages are bigger and smaller, but obviously the touch points are going to be pretty similar because we go after certain anatomy locations. So when you look at somebody and to address a diaphragm reset, what to look for? Chest breathing. So if somebody's a chest breather, they're going to really basically tell their body to go into fight or flight. Typically going to be stressed out or high anxiety individual. Their shoulders may be forward, walking, leaning forward, poor posture, head leaning forward, tight thoracic causes shallow breathing as well. So, when you get up in the upper back and traps and everything else, so that area can identify shallow breathing, won't let you expand and contract. Obviously, stressed out is going to be an indicator of shallow breathing. Tension headaches is another one. Just the traps and neck muscles themselves. Obviously, if somebody is stressed out a lot and breathing poorly, they're going to have tension headaches, poor HRV readings, and then high cortisols. So the last two, obviously, you'd have to be able to identify those two in different ways. So again, this is the diaphragm reset. We run that sternum down, and we run right at the edge of the rib cage, right where that diaphragm sits. And you put application, you put tension across there. So this next slide is going to go into that. So what we do is to teach our clients in zone 1 in the diaphragm reset, you would run the sternum down. So you would take your knuckle or your thumb and put tension rubbing up and down. What we're going to do is go after the fascia line as well, or we might find adhesions in the fascia, and we may break those up so that way we can expand and contract our rib cage properly. Because if we're shallow breathing consistently, it's going to be very challenging for an individual to do a good diaphragmatic breath and get all their breath in and all their breath out, because the rib cage and the soft tissue and connective tissue around that could be really tight. So we're going to rub the thumb in a small segment down, which I have it highlighted here, down the sternum from the collarbone just above the xiphoid process. The xiphoid process is right there in the middle, where it makes the upside down almost Y or T. You just got to watch the xiphoid process because it can be very tender, so you kind of want to stay away from the xiphoid process. With the fingers, follow the edge of the ribs out to the bottom of the ribs and back to the bottom of the sternum. rub back to the top of the sternum. If you find something that feels, gristly, in lumpy, stay on that area for a few minutes. Obviously, you do what you can tolerate. Make sure you consistently do your breathing technique while you're doing the application. Take care to breathe through the wake up drill. You want to make sure you do the diaphragmatic breathing into your nose, out to your mouth. If you get really good at it, it's into your nose, out to your nose. So that's a diaphragm reset. Now we're going to go in again. These are all zone 1, the psoas reset. So this shows you the location of the psoas reset. The psoas is internal muscle. We will never necessarily make contact. We put tension on top of the tissue to affect the result. So what to look for when somebody, has issues with their psoas. Typically, they're going to have larger quads because they're quad dominant. They're not using the posterior chain correctly. The abs are tight, and that's common with somebody who has larger or tighter quads. No space between ribs and hips, which I would identify and show that. I've showed that to some clients. Should be 4 fingers in between the top of your hip and the bottom of your rib cage, where rib cage starts. If you can't get 4 fingers in there, obviously you're crunching down or getting pulled forward. Excessive tightness in planking, low back tightness, pain while squatting deep. All those are indications of the psoas needing to be reset, or issues with the psoas. So now we're going to go into the touch points and the activation application of the psoas area. On both sides of the abdomen, about 1 inch out and 1 inch down from the navel, find a spot on either side of the fingers and rub. So what you're going to do is you can either use your fingers or your thumb, or a combination. Often people talk about a hot sensation when they find the right spot. So if it starts warming up, you're like, oh, that feels kind of odd, or it feels a little warm. Typically, you're hitting that area properly. The specific location will vary based upon the individual. They may have to dig around, to find the right spot. But this is the general vicinity of the psoas wake up drill for zone 1 in the RPR. And what you can do is you can push back in 45-degree angle and work up and down as well. So there's a couple different techniques that we can show you how to do that. Again, this is the psoas wake up. And then we're going to go into the glute reset or glute wake up. What to look for in this one, obviously hamstring issues, very tight hamstrings or pulls, low back pain or issues, excessive anterior pelvic tilt, shifting hips in the squat. So somebody's hamstrings are extremely tight. Typically, there's an issue with the glutes. And if you address the glute wake up, then the hamstrings typically relax because the body is communicating properly. When we talk about these wake up drills and reset drills, we're addressing the communication, so the central nervous system, the communication pathways. So if we get the glutes to work better, the hamstrings are going to stop working as the glutes, so they'll relax a little bit. And just with diaphragmatic breathing, typically, if you can get somebody to dial in the diaphragmatic breath properly, their hamstrings will relax and loosen up. So the glute activation reset area is rubbed along the ridge of the skull, from the center out of the edge and back to the center. So if you see where I put this line across, if there's anything tight or ropey back there, you may feel some areas. I typically do. You want to spend some additional time on it. You can use the thumbs and press behind the edge of the jaw. I typically use my fingers to go behind the jaw, but you can use your thumbs as well. Aligning pressure towards the back, of the eye. So almost when you want to push your finger or thumb right up to your jaw and out your jaw as well. This may leave a mark along the occipital. That's normal. So if you have a red mark, no worries. But it may get tender through there, but you're going to work this line back and forth. So that was all in zone 1. I'm going to punch through this review again, just to hit the 3 areas. Obviously, We always want to start with the breathing, then we'll go into the diaphragm reset, and then we'll go into the psoas area reset, and then we'll go into the glute reset, the back of the skull, and then the jawline. So hopefully this gives you a better understanding of zone one, and with the application side of things. So when you come in our facility, you're a little bit more familiar with what zone one looks like and how to apply that.